great. Stuart Blackwood here, Blackwood Vascular. Again, this is all medical education, not advice. This short is about dissections in the arteries. Dissections in arteries, and how do we manage them? Arteries, R-I-E-S, whatever. So the point is that I'm in the vein center and my tech asked me if he did, my ultrasound tech, if you did see a dissection, how do you actually manage it? Because they talked about how did I find them, but then how do you actually take care of them? And so if you think about it, a dissection is a split in the blood vessel, like this, right? So this is the normal, the true lumen. This is what's called the false lumen. If you put a needle in, for example, through the actual artery, and you ended up making a hole as you were doing a procedure like a heart catheterization, and you went into the wrong layer, then you could have what's called a dissection. And you can see there, that is a dissection. We're not in the true lumen, which is down here, we're in a false lumen. This is usually not a major problem in a lower extremity, for example, when you're going up against the flow of blood. Blood is going this direction. Then even once you pull out the catheter, then typically it will be hard for that blood to return and go upward and create this and make this wider and wider and cause what's basically a retrograde dissection. This becomes more of a problem if the blood is flowing this direction and you punctured in that direction, and now you can see how you could actually close off the lumen. How we typically manage dissections: number one, we just lower the blood pressure automatically. Usually we use beta blockers, etc. We treat the patient's pain so that their sympathetics, their fight and flight hormones don't cause them to have a higher blood pressure, which then causes the split in the artery to happen more. We treat them with antiplatelets as well as anticoagulants to stop clots from forming in that dissecting lumen. And then if we need to, depending on where it is, we might need to do other imaging like CAT scans or MRIs or ultrasounds. And then finally, we follow them over time to look for aneurysms, because over time, if you think about it, if you have dissected the wall and it's now weakened, this over time can just expand and become an aneurysm, whether a false aneurysm where it's just this portion of the wall, or a true aneurysm where the whole thing swells. So we look for aneurysms over time, swellings of the blood vessels, and we watch out for clotting. And basically, we're going to treat it either by putting a stent in it to keep it open, removing it by resecting it surgically, just cutting the whole thing out, or even doing a bypass of some sort. So those are the main ways to manage it. Hope that was helpful, and you guys, if you like that video, just follow along.